we wanted to continue our discussion about biometric labs. So last week you kind of got an overview of some of the blood work that would be done, and this week we wanted to talk about some of the additional measurements that will be taken when you're getting your blood work. So one of the things that we're going to be checking is your blood pressure. So elevated blood pressure or hypertension is a very common disease, and one of the things why it's so important is because a lot of individuals who have high blood pressure are completely asymptomatic. You know, it's not until those blood pressures are reaching extremely high numbers that then people begin to have issues that we are concerned about, such as headaches, dizziness, lightheadedness. And so we want to catch it when it's still at those lower numbers so we can get you started on the proper treatment. And, you know, we worry about elevated blood pressure because that damages the lining of our arteries and our vessels. And then that injury can increase our risk of heart disease or potentially a heart attack or stroke in the future. One of the other things that will be checked is also your waist circumference. And we worry about waist circumference because this has also been linked to increased risk of coronary artery disease, diabetes, high blood pressure, high cholesterol, all of the things that we know long-term impact our overall health. And so ideally for women, the waist circumference should be less than 35 inches, and for men, less than 40 inches. So we know that if we're able to get those numbers down, then that increases reduces your risk of having a heart attack or a stroke in the future. These aren't issues that will happen overnight. You know, it is really an accumulation over time. So we worry about these conditions after 10 to 15, 20 years. And so we really want to get started sooner rather than later because prevention is the best way to improve your overall health. We want to get ahead of things and not treat it afterwards. So hopefully this clarifies why we're doing some of those additional testing on the day of your labs. But if you have any other questions, you can always ask one of the other staff members or one of the providers that's on site. Have a great rest of your day.